Hello, I'm Kathy LeMay. I'm here at St. Joseph's Hospital Foundation talking with Dr. Jacques, director of our heart failure clinic.
That is correct. It is good to have you. Thank you for having me.
I have a few questions for you, doctor. And first, tell us briefly about St. Joe's Heart Failure Clinic.
I'm glad you asked. So when I joined here about a year or two ago, I had in mind to develop a heart failure clinic that is mainly community hospital based. So the idea of the community hospital is to improve quality of care for patients that have heart failure, but also to increase or to improve clinical outcome for such patient having such disease. The goal really is to utilize an interdisciplinary team approach to take care of patients with such a chronic disease. The goal would be to implement medications, to provide education, to provide a platform by which the patient can have quick access to their providers if they have questions, if they have concerns or signs that are concerning. Really, the philosophy is to increase quality of life, decreasing hospitalization for patients that have heart failure.
So why is a community-based setting so important for these patients, doctor?
That's a great question. So heart failure really is a chronic disease. And as such, those particular diseases tend to interfere with patients' everyday life. So the idea is to provide a community platform by which we can treat those patients without interfering too much with their everyday life, and allowing them really to have a life while they are still having their chronic conditions. So at times, when you don't have such a community approach, it becomes difficult really to either detect disease quickly and to treat it appropriately, or to allow the patient to have access to their providers so they can ask questions and have them answered quickly.
So how do you care for patients in a setting like this with the aim of getting their care at home?
So heart failure, as I mentioned, is a chronic disease. The chronicity of such disease is just punctuated by episodes of decompensation. So when the patient has symptoms of difficulty in breathing, they have lower extremity swelling, they cannot do their normal activities, they end up going to the hospital to find care, and where they would receive diuretics, something called a water pill, so that they can get rid of those excess fluid. Unfortunately, during those settings, it is very difficult to really implement medication that have long-term benefit for those particular patients. So those medications requires monitoring, a lot of education, up titration of those medications, and again, it is very difficult to start such medications in the hospital setting. So with a community approach that would allow us not only to implement such medication, up titration of medication in a safe manner, allow for the interdisciplinary team to provide adequate education for the patient about their medication, education not only about for the patient, but also helping the patient to be part of their own health. So the way we intend on doing this, one way that we intend on doing this, is to have what's called a home heart failure kit. And the idea really would be a kit or a box that contains educational materials, a blood pressure cuff, a saturation device, and in some cases an electronic tablet that would allow the patient to enter information by which we can kind of go back and forth. So first, data collecting from our part, engagement of patient into their own health, a way by which the interdisciplinary team can know what's going on with the patient, and early alarm that would tell us there is early decompensation or progression of their disease, so action can take place.
So what can people do to help?
That's a great question, and I'm glad that you asked that. So of course, implementation of such a kit requires a little bit of a legwork and also some financial needs. So for now, we have in mind of having about 12 of those kits made. That would roughly we would need to raise about $18,000 really in order for us to have such a kit to be made. So as such, any donation would really be welcome of any amount, really, because the idea is to provide such a kit, especially to the least fortunate of some of those patients, because they are the most vulnerable. They are going to be the one really benefiting from those particular the kit, but unfortunately would not have access to it otherwise. So again, the donation would be really, really welcome.
So doctor, can you give us a few quick tips so that we can stay heart healthy?
That's a loaded question and would require another interview, but let me kind of summarize a little bit. The first thing I always tell my patient is that first, get active. If you are not doing anything, get up and do something. I know right now the weather is not really conducive, but when it is appropriate, get up, walk, do some few stuff that you're happy doing, but that involves you walking, doing some activity, get your heart rate pumped up a little bit. I would say also check your blood pressure, make sure that it is adequate. Talk to your primary care team and ask them where exactly they would want your blood pressure to be. I would also tell you, make sure that you are on top of your cholesterol and blood sugar. Again, talk to your primary, talk to your providers and ask them what can you do behavioral wise on how you can manage those numbers. We would say also eat a healthy diet. Make sure that you lose weight if there is a need. And also, of course, if you are drinking in excess, moderation would really be the way to go. And if you're a smoker, we would really advise you to discontinue.
Well, thank you.
Welcome.